Hello, I'm Dr. Jewel Stevenson. I'm a family medicine physician, and I'm a member of the Archway, Missouri chapter of the Links Incorporated. As an organization, we are committed to expanding knowledge on kidney health awareness for African Americans. The Black K.A.R.E, K-A-R-E project, which stands for Kidney Awareness Resources and Education, is a national effort to address risk factors, complications, and treatment to reduce the risk of kidney failure. We are fortunate to have with us today two physicians who specialize in kidney care. They are nephrologists. Dr. Stanley Buck and his son, Dr. Jonathan Buck, are not in practice together, but they are both dedicated to the care of individuals with chronic kidney disease. Dr. Stanley W. Buck is a board-certified nephrologist and board-certified internist. Dr. Buck is a graduate of Princeton University and Washington University Medical School. He has maintained a private renal practice for over 30 years. Dr. Jonathan B. Buck is a board-eligible nephrologist and internist. He is a graduate of Duke University and St. Louis University School of Medicine. Dr. Buck earned a master's in public health at Morehouse School of Medicine. In 2021, he completed his nephrology fellowship at St. Louis University. 1 out of every 3 adults in the United States is at risk of life-threatening kidney disease. Most people don't even know they are at risk. So, what is kidney disease? What do the kidneys do?
The kidney is a very complex organ. It's like a filter. It tends to regulate. It regulates several things: the fluid in your body, the amount of sodium in your body. It regulates your chemicals like potassium, calcium, magnesium, phosphorus. So it regulates. It keeps the level of urea fairly low when it's functioning properly. So kidney disease is when the kidney is not regulating properly, and more specifically, when the urea level is rather high as opposed to the normal level.
Black Americans are almost 4 times as likely as white Americans to develop kidney failure. Why is that?
It could be because there's higher incidence possibly of diabetes, hypertension, and those are the 2 main causes of kidney disease or progressors of kidney disease. There are also a ton of other things that can cause kidney disease, like lupus or other specific conditions.
Caucasians will have hypertension, but they may have better access to healthcare, more awareness of how to question things and to follow up on things. So I think it tends to be more severe in African Americans.
What are the signs of kidney disease? What should a person look for?
I think the main thing to sort of start off with is basically following up with your primary care doctor, because if you're following up with your primary care doctor and you get labs at least on an annual basis, you can follow your serum creatinine, which is basically a marker for kidney function. You can also follow your GFR, which is your glomerular filtration rate, basically how well your kidneys are filtering the fluid, the blood, basically in your body, and able to regulate the, electrolytes or the sodium and the potassium, but also like acid base and also urea, like my dad mentioned before, in addition to a lot of other things. So the thing is, if you're following with your primary care, they should be able to pick up on that earlier and be able to alert you to the fact that you have kidney disease and if it's progressing. And then if it progresses to a certain point, you can be referred to a nephrologist or a kidney doctor to basically have more, I guess a better management of that kidney disease or more close monitoring of your kidney disease so that it doesn't progress further towards needing dialysis. But I think the other thing to basically keep track of, for example, from like a symptom standpoint, could be things like if you're getting like lower extremity edema or swelling in your legs, if that makes sense.
If you are diagnosed with kidney disease, What type of care is necessary?
Well, there's different levels of kidney disease. So if you have maybe an early level like stage 1 or stage 2, stage 1 means you have 90% kidney function or better. The care is just follow up and prevention of worsening. The same with stage 2, you just follow up, find factors that may have caused it, and try to regulate those factors. Reduce the amount that you smoke, reduce the amount of salt you eat, have your pressure checked very carefully. If you are diabetic, take it very seriously and manage it very closely. Now, if you have the later stages of kidney disease, you start retaining fluid, which is called edema. You start showing signs of congestion in your lungs sometimes. Your blood pressure becomes more difficult to control in the later stages, so it requires more intervention with your physician. And like Dr. Jonathan said, the key is to get follow-up. Check your labs. If you have questions, ask questions. Personally, I think if you're African American, over the age of 50, you have a kidney problem, you should probably refer yourself to a kidney doctor just so you can get more information and ask more questions.
You mentioned different stages of kidney disease. At what stage of kidney disease do we call it kidney failure?
So there's 5 stages of kidney disease, 1 through 5. 5 being like the end stage, to a point where you may need dialysis depending on if you develop symptoms. So typically patients who end up on dialysis are patients who they can't manage their fluids like medically, meaning that if they're taking water pills like Lasix or furosemide, that it's not really helping with their volume status or the fluid that's basically accumulating or building up in their body. Sometimes it might be their potassium levels, that the potassium is not being able to be managed medically, that the medications that we're giving them, whether it's Veltassa or whether it's K-exolate, certain binders that basically bind up that potassium and help get rid of it, basically aren't helping as much as they should. Sometimes it's the person's becoming uremic, so their urea level, like Dr. Stanley Buck was mentioning before, is building up to a point where they're starting to have signs of confusion or itching or things like that.
Can you give us the main takeaway that you'd like to leave the audience with?
Well, it all starts, like Dr. Jonathan said, it starts with hypertension and diabetes, very often both in the same patient. So what causes those things? Usually lifestyle adaptations, inactivity, too much sodium intake, smoking, heavy drinking, and obesity is a big factor in the African American community. Obesity. Check your body mass index and see if it's above 30. If it's above 30, get it below 30. Normal is 25 or less. But obesity is a big problem, and it leads to hypertension and diabetes, high cholesterol, heart disease, and kidney failure.
Excellent.
So I always encourage my patients basically to ask questions. And if they don't understand what's going on, to make sure to ask clarifying questions, to be like, hey, what does that mean? I'm not understanding what's going on. Because at the end of the day, it's information that impacts their health. And at the end of the day, it's information that impacts their life. If that makes sense.
Thank you, Dr. Stanley Buck and Dr. Jonathan Buck. We hope that this information has been helpful for those of you watching. Please take a moment to visit the Black K.A.R.E website. Here, you will learn about chronic kidney disease and how to prevent it or slow the progression if you already have chronic kidney disease. Awareness and knowledge will empower you to take charge of your own care with your healthcare team. Thank you and have a great day.